The 2008 Gallup-Healthways Well-Being Index, tracked daily, finds that 49% of Americans are thriving, 47% are struggling, and 4% are suffering.
So there are dimensions we measure around health, whether people have health problems that keep them from doing things other people their age normally can do, do they have a disease burden, etc. Those all help us predict whether someone is likely to be thriving or struggling or suffering, and they help us understand what's behind those more general figures.
Last year, the U.S. government spent $2.3 trillion on health care. In 2000, the World Health Organization released a report ranking the United States healthcare system at 37th in the world. With so much money being spent on health care, why is the U.S. not at the top of the list?
There are two main reasons why the United States is probably not number one in health, despite our big investment. One of those reasons has to do with where we put our resources. We spend about 97% on disease care, and most of that at the end of disease care, and not enough on protecting health or helping healthy people stay that way. But we also are a nation that is plagued with extremes in health disparity. Our system is really designed to incentivize paying for disease rather than paying for good health.
Measuring health and well-being, according to the CDC's Dr. Julie Gerberding, is one way to tackle the issue, helping governments and business leaders move away from reactive to proactive policies.
The first step is really to measure. We've got to measure health, or well-being, if you will, and there are many different ideas right now about how to go about doing that. One of the things we're doing at CDC is establishing some health goals, and we've set out to look at people at various life stages and in various locations to determine what would it mean to improve the health of this population in this setting. Because we believe if we can measure health and we can set some goals, we actually will be able to learn what it is that will make the most difference.